Hi everyone, welcome back to my channel. Today we're starting our first subspecialty spotlight with pediatric radiology, and I'm super excited to have my first guest on this YouTube channel, Dr. Ami Gokhale. She's a pediatric radiologist, and instead of me continuing to talk, I will have you tell us a little bit about yourself and your journey to pediatric radiology.
Sure, great. Yeah, I was actually raised in Virginia, and I did a little bit of back and forth. I went to NYU for college, and then I came back to Virginia for medical school. And then I went back to New York for radiology residency at Staten Island, and did my fellowship at CHOP in Philly. And now I'm actually back in Staten Island.
Awesome, that's great. CHOP is like an incredible place to train, so that must have been a really fun experience.
It's amazing. The staff there and my colleagues were just so awesome. I stayed there for 3 years, a couple years after fellowship, so it was nice.
How did you find pediatric radiology? Did you always know you wanted to do that?
I did not always know. It actually took me a really long time to figure it out. So it took me a while to get to radiology too. I was a little bit against it. I was like, well, I had an aunt in radiology, and I was like, well, I don't want to be sitting in a dark room and not talking to anyone. And they're all kind of weird. Their personalities are a little strange. So I was like, no, that's not for me. And then I saw the light kind of later on. I think a lot of people get exposed fairly late in medical school. You don't have a lot of exposure in your first and second year.
Right.
And I didn't either. And so I go to my radiology clerkship, and I was a little bored, to be honest. I was just sitting there watching people scroll, and I don't think that that's really the best way to figure out whether you like radiology or not. I feel like you have to take the wheel, like scroll through the images yourself, like try and find the pathology, try and identify the organs and things like that, because otherwise you're going to be like, oh, this is not for me. But
yeah, exactly.
Yeah, so pediatric radiology I chose very late, and I don't think I really realized how much I would like it until I went into it. I wasn't sure. My reasons were a little vague, but I was pretty set on it. And now that I'm doing it, I just can't imagine doing anything else. First of all, we see a huge variety of cases all day. So I read MRIs, CTs, X-rays, ultrasounds, fluoros, all in the same day. And I get to kind of like move around and do different things, whereas a body imager might just be doing body CT, or a chest person might just be doing X-rays all day. So I love the variety, and we also do all parts of the body. So even all the different modalities we do, the brain and the spine, and then like my next thing might be a trauma X-ray with a fracture, and then I might do an ultrasound of the abdomen for an appendicitis. So a lot of variety. It keeps me, I'm a little ADD. It keeps me awake. It keeps me interested.
Radiology is great for that. There's always so much diversity.
Definitely.
Do you get to like talk to patients? You talk to parents a lot? Like, tell me about that.
I do, yeah. To be honest, that's my most rewarding part of the day. So as a pediatric radiologist, we see a lot of patients, and it's a lot more than I realized initially. So we get to interact with people when we do fluoros, when we do ultrasounds. We get to talk to the parents and the families, and we kind of get to just give them their diagnoses right on the spot, which is so great. We get to chit chat with them about what's been going on. And they're usually just so thankful when you're, in the room and you're able to say like, oh, it's, nothing. It's not appendicitis. It's not a surgical thing. Or, you're in the ultrasound room maybe and diagnosing an intussusception, and you can say like, okay, this is an intussusception. It's not a permanent thing. And it's something that actually I can treat. So why don't I just take you over to this suite right now, and I'm just going to take care of it right here, right now. And they're just so great. They're so thankful. And it's such a nice breakup of the day, being able to talk to people. You're not just kind of sitting there and reading studies all day. So I love that.
That's awesome. I love that, like in radiology, we get to see so many patients. It's definitely one of the misconceptions that I feel like medical students have, because we just don't get exposed to radiology early enough. So that's
definitely
awesome. Do you work in private practice now, or do you work at an academic institution?
So I'm actually in a hybrid practice. It's technically an academic institution, but it's not a large one and it's not a big peds hospital. So we're not like putting out a lot of research, but we are a teaching hospital. So we have residents, we have medical students. Some of our departments have fellows, and we get to interact with all of the trainees and teach them. But we also get to do a good amount of clinical, and we're not really like taken away from all of that to do research, which is kind of nice.
That's awesome. That's really nice, actually. So, did you have a hard time finding your job? Like, I know that a lot of people are worried about going to pediatric radiology, but really the job market is pretty open from what I understand.
Definitely, definitely. I think job markets in general are always fluctuating. To me, somebody explained it to me in med school as a sine curve where like it's just up and down all the time. And it's just a matter of like, when are you kind of jumping into the job market? Right now, pediatric radiology is an amazing job market. You can pretty much get a job anywhere in the country, including super popular areas, and people are getting great deals. People are getting great salaries. So that's all really good. The thing that I love about peds radiology too, which I think is a little bit of a misconception, is I think people just assume that you have to be at a big children's hospital, but that's definitely not the case. I have a lot of friends who are in private practice pediatric radiology, and there's people who are in, huge academic centers like CHOP, and those, they have a lot of resources. They have a lot of people that help them, with research and things like that, which is great. And then there are hybrid practices like mine, where I get kind of the best of both worlds. I can do a little research, I can do a lot of clinical, I get a lot of hands-on kind of practice, and I get to talk to like the residents and chat with them all day. So yeah, there's a lot of job opportunities, and it's a lot of different types of jobs that you can get, which is cool.
That's awesome. That's great. That's really reassuring for people that are interested in peds, because I know that's definitely one of like the concerns. Did you ever think you wanted to do like just pediatrics when you were a med student? Or
Actually, funny you should ask. I definitely did. I wasn't sure what I wanted to do in med school. I was one of those people that I would go through each rotation and I was like, wow, I could do this. Like, this is fun. I like this. And so at the end of the rotations, I was like, oh my God, what am I going to do? I can't choose anything. And I was drawn to peds mostly because I'm good with kids. It was easy for me to distract them while I was doing the physical exam. And those kinds of skills come in handy for me now, because I'm trying to do an ultrasound and I'll be like, distracting them with the gel, or like, doing something around their face while I'm like ultrasounding. And so, yeah, I really kind of took to it. And some of my mentors had told me that it would be a great field for me to go into. And so I considered it, and it was a little bit, I guess, just like a little slow paced for me. And I was just looking for something a little bit more stimulating. And for some reason I didn't put two and two together. And I just kind of eventually kind of walked away from peds and went into radiology. And then when I was in radiology, I was like, I don't know what I'm going to go into. And I was thinking about MSK. I was thinking about maybe body. And then I just kind of naturally got drawn to peds again. And I was like, oh, I never thought about this, but this makes a lot of sense.
yeah, that does make a lot of sense. When I was rotating through pediatric radiology, I had kind of the same feeling where I was like, wait, I really like this actually. But the reason I really liked it was a lot of the hands-on stuff. Can you tell me like what type of hands-on things do you do? You mentioned ultrasound and resolving intussusception, but what is it really like?
Yeah, so I'll just give you like a day in the life of a pediatric
Perfect.
radiologist. It's like, so I wake up in the morning, I go to the gym because I'm a crazy person, and I go get my coffee, I drive into work, and in the morning I usually kind of stack my procedures. So I have fluoroscopic exams. So those are things like upper GIs or esophagograms, swallow studies. You can also do procedures like intussusception reductions. And so I go in, I talk to the patient. Usually it's like, oh, I've got, something stuck in my throat, or I feel like, I had a girl the other day who was just vomiting constantly and couldn't figure out what was going on. And so those cases I do in the morning. And in between those, I also do ultrasounds. So there are some ultrasounds that I will scan myself as a pediatric radiologist, because we don't have peds trained ultrasound techs at the hospital. And so we kind of like tag team it. So most of the time they're fine. Some of the times they want me to back scan for them. So for pediatric hip ultrasounds, I'll scan them myself, or neonatal spine ultrasounds, I'll scan myself. And those are all really fun because they're really tiny babies and they're very cooperative because they can't move around too much. And so you kind of get to play with the baby a little bit and do your scan and talk to the mom. Usually it's like a new mom and they can kind of chit chat with you, which is fun. And then in between all of that, I'll be kind of reading studies. And so usually I'll do formal readouts with my residents in the morning and in the afternoon. So I'll read kind of the list a little bit and then go over it with them, kind of teach them the things that I see in the ultrasounds and the x-rays or whatever it is that we're reading. And then the peds team comes down, which is another favorite part of my day. So the clinicians come down, peds, PICU, NICU, and they'll discuss all their cases with us, which is so great because you get your clinical correlation, you get to kind of ask them what's going on, and you really get to know the patients too. So I'll be like, oh, how is, this patient doing today? I see that their x-ray is getting a little bit better. Are they breathing better now? Are they doing okay? And it's kind of nice because you feel very connected with your patients, which I think is pretty unique to peds. Pediatric clinicians are typically very collegial, and they really care about what you say, and they really want to know kind of what your opinions are on the imaging, and then they'll directly change their management because of that. So it's really nice.
That must be so gratifying to like get the full picture, like you see the images, you get to talk to the doctors that are taking care of the patient, and I can definitely see why that would be so, the feeling, it must feel really nice.
Definitely, yeah, it's great.
So, any concluding pieces of advice for someone exploring radiology, pediatric radiology?
I would say I just want you guys to remember that radiologists are not just stuck in a dark room and not talking to anyone. We talk to our colleagues, we talk to our clinicians, we talk to the families. Those are some of my favorite parts of the day. So don't forget that. Also, taking care of kids can be difficult, especially seeing sick kids, but don't forget that they heal really quickly and really well. So it's also really nice to kind of see them pop back and just be totally fine. So I love that part of it. And don't forget that radiologists, the future of radiology is really, really cutting edge. So I feel like, if you're interested in technology, artificial intelligence, future technologies are going to be incorporated into practice. So I think the landscape for radiology is really changing, and kind of we can decide what's going to happen. So, we might move towards applications in diagnostic imaging and the treatment of cancer or other diseases. There are new fields out there like radiogenomics, relating imaging biomarkers to genetic and molecular features. So I think imaging is going to be a really essential kind of part of patient care. We're going to have maybe patient-tailored therapy planning, and there's a lot of up-and-coming stuff. So it'll be really interesting to see where things go. So anyone interested in that would be pushing the field.
That's great. Yes, I always tell people that like the technology is not going to take over radiology. We just get to use it every day and make our patient lives better.
Exactly.
So. Well, this was awesome. Thank you so much for being on my channel.
Of course.
I think that I hope that everyone learned something about pediatric radiology. I loved it when I was rotating through. I almost did it. I was this close to applying for peds because it's like so gratifying and fulfilling seeing little babies. They're so resilient and they're so cute.
Yeah, it's so fun.
Anyways, I will have all of Dr. Gokhly's social media linked down below because she is a force and she's doing awesome things in the field of radiology and pediatric radiology. And you can obviously follow her there. And I'm sure she would be open to answering your questions if you were to tweet at her or message her or something.
Absolutely. Yeah. Please tweet me, email me, whatever you want. I'm happy to answer anybody's questions.
Awesome. Well, I will see everybody in the next video. We're going to be doing these subspecialty spotlights. And if you're a radiologist watching this and interested in being on my channel, please message me and reach out. I would be happy to have you. And again, thank you, Dr. Goku. That was awesome.
Great.
All right.
Thanks so much.
Bye.
Bye.
Okay.